नमस्कार। स्पिरिचुअल डॉक्टर्स फॉर होलिस्टिक हेल्थ पर आप सभी दर्शकों का, मित्रों का, डॉक्टरों का स्वागत है। ऑन द प्लेटफॉर्म of spiritual doctors for holistic health, we invite one senior health expert, is doctor of researcher mindset, and today we are going to discuss second most common healing modalities after allopathy, which is acupuncture. I am also a practicing acupuncturist, but with us today is Dr. Raman Kapur, who is chairman of Department of Acupuncture at Sir Ganga Ram Hospital, New Delhi. For last more than 3 decades, he is practicing this acupuncture, which doesn't use medicine. Most of the people think that medicine is the only way, which is not so. Beside the mainstream medical method, there is energy medicine, acupuncture, Meridian system. Lots of work has been done internationally. In India, we are gearing up with the development of the protocol, the syllabus, and the council. India is a developing country, so it is taking some time, but in due course of time, we all get benefit of acupuncture, which doesn't have side effect like allopathy. And my personal journey with acupuncture is with my guru Kashi Mishra sir, who is from Allahabad. And basically I am a meditation practitioner, and in my meditation practice we discourage use of allopathy. Sweta Agrawal ma'am is here, who pushed me to this acuscience. जब मैंने एक्यूपंक्चर और एक्यूप्रेशर के रिजल्ट देखे तो मैं भी इसमें फुल टाइम शिफ्ट हो गया। हेल्थ इज अ बर्डन फॉर कॉमन पीपल, लेकिन अगर हमारे पास वाइड ट्रीटमेंट मोडालिटीज हैं तो फिर हमारे साथ वो इश्यू नहीं रहता है। डॉक्टर संदीप, क्या कहना है आपका?
नमस्कार सभी दोस्तों को। एम आई ऑडिबल डॉक्टर रंजन? यहाँ पे नेट का प्रॉब्लम है।
नहीं,
तो डॉक्टर रंजन, मैं तो ये बोलना चाहूंगा, एक्यूप्रेशर से जो एक्यूपंक्चर से मुझे इंट्रोड्यूस कराने वाले आप थे, तो मैंने आपसे एक्यूप्रेशर के बारे में सीखा, जितना सीख पाया या नहीं सीख पाया, जितना मैं यूज कर पाया हूँ अपने क्लाइंट्स के ऊपर, स्पेशली डायबिटीज के जो क्लाइंट है उनके लिए। तो मेरे को इतना ज्यादा इसके बारे में, डेप्थ के बारे में मालूम नहीं है, लेकिन जितना मुझे जिन जैंग और एनर्जी मेरिडियन सिस्टम के बारे में पता चला, उतना मैं फैसिनेट होता गया। हमारी बॉडी के अंदर जो जितनी एनर्जी चैनल्स है उनको हम कैसे मैनेज कर सकते हैं, कैसे जहाँ पे एनर्जी कम है वहाँ एनर्जी बढ़ा सकते हैं, कहीं ज्यादा है वहाँ कम कर सकते हैं। मेन डिजीज का रीजन यही है, इम्बैलेंस। तो मैंने सीखा। तो डॉक्टर रंजन, मैं तो ये बोलूंगा, आज हम बहुत भाग्यशाली हैं। डॉक्टर रमन कपूर, जिनके बारे में हम बात भी करते थे, इंडिया के बारे में लीडिंग एक्यूपंक्चरिस्ट है, जिन्होंने अपने लीग से हटके अपने MBBS डिग्री करने के बाद, वो भी 30 साल पहले, ये डिसीजन लिया दैट आई विल परस्यू दिस थिंग। तो मैं इसको डॉक्टर रंजन यही मानता हूँ, दिस इज ए कॉलिंग। हर किसी साथ नहीं होता कि हम जब मेडिकल स्कूल में होते हैं तो आजकल, या पहले का मुझे इतना मालूम 30 साल, तब तो ऐसे होता था, मैं सर्जरी करूंगा, मैं गायनी करूंगा, मैं USA जाऊंगा, मैं ऐसा करूंगा, या उसमें से कुछ 3-4 लोग सिविल सर्विसेज करेंगे। लेकिन कोई उनमें से ये नहीं बोलता मैं एक्यूप्रेशरिस्ट बनूंगा, मैं साउंड डीलर बनूंगा, मैं इस तरह मेडिटेशन टीचर बनूंगा। तो मैंने ऐसे डॉक्टर्स को बहुत कम देखा है। तो इट्स रिमार्केबल एंड दिस प्लेटफॉर्म इज रिमार्केबल। डॉक्टर रमन कपूर जैसे लोग आ रहे हैं और आप उन लोगों से हमें मुलाकात करवा रहे हैं साथ में। और मेरे को जितनी नॉलेज है डॉक्टर रंजन, मेरे को इसमें कहने में कोई हर्ज नहीं है, मैंने आपसे ही सीखा है। तो एक्यूप्रेशर के मेरे गुरु तो आप ही हैं। तो ओवर टू यू डॉक्टर रंजन। तो आप बताएंगे मैं कैसा स्टूडेंट हूँ या मैं कैसा कर रहा हूँ।
अगर 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 जो फीडबैक हमारा लास्ट था लंग फाइब्रोसिस के केस में, अगर बेनिफिट मिले
Yes,
एल्यूसिक एक्यूपंक्चर पॉइंट से, तो एक्सपीरियंस एंड पर्सनल बेनिफिट, पर्सनल एक्सपीरियंस। डॉक्टर रमन कपूर
definitely.
सर का मैं वीडियो देख रहा था, हमारे मित्र डॉक्टर सचिन हमारे प्लेटफॉर्म पे जो आए थे टाइम।
It's 11:11, Dr. Ranjan. So,
या तो
can we introduce Dr. Raman and we can invite him on that
या
chat?
तो रमन सर, आपका स्वागत है स्पिरिचुअल डॉक्टर्स फॉर होलिस्टिक हेल्थ के प्लेटफॉर्म पर।
बहुत बहुत धन्यवाद. I hope I am audible.
यस सर।
Yes, sir.
And I hope the video quality is also good.
Very good, sir.
Very nice. Good morning to everybody. I'm very thankful to Dr. Ranjan, Dr. Sachin, and all the members of the society, spiritual society, for having invited me today on this platform. And I hope that at the end of the session, you would all have gained some of my experiences, as I have traveled 38 years of my life into acupuncture. I started way back in 1982. So it's the 39th year now, and I head the Department of Medical Acupuncture at Ganga Ram for the last 22 years.
Dr. Raman, can we ask one more question from you, if you
Sure.
allow, before going to a topic?
Yeah.
How this journey started, sir? कैसे आपने MBBS के बाद
It's a
मेडिकल
very
स्कूल के बाद
interesting
ये
episode which I
Yes,
must
please.
share. You see, what happened was that my sister, my elder sister, she is a doctor also, and she lives in Australia, in Adelaide. And she's about 8 years elder to me. So my brother-in-law and my sister would be regularly coming to India every year for a holiday. So it was one of those holidays when they were here in 1981, 82, and I was just preparing for my postgraduate entrance exam, as usual after our MBBS, after our house job. Our times we used to have internship and then house job. So, and then the PG exam was there. So I was preparing for the PG exam, and then my sister asked me casually, "What is your subject of interest?" I said, "Medicine." He says, "Raman, medicine is something which people have been doing for time immemorial. Why don't you think of doing something different?" So I said, "What is that different?" So she says, "It is growing like wildfire in Australia at that time." This is what her words were. And although both of them are allopaths and both were GPs in Adelaide, they said that they don't do it, but a few of their colleagues had gone to China, mainland Beijing, and learned it from there. So why don't you go and do something different? So I obviously did not like the idea, because going into a new system in the dark, it was very difficult for me. So I just said, okay, can we talk to somebody who was doing that? So those days used to have those landline only. So we fixed up a call and talked to one or two of the doctors who were practicing, and they were allopaths, and they had gone to Beijing, and they had done a 6 months course, which was at that time the basic course for medical doctors at the Beijing College of Acupuncture. So, and luckily for me, the situation enveloped in such a way, as I call destiny, that after the entrance exam, which was to take place in a week or 2 weeks' time, there was a gap of about 3 to 4 months for the results to come in. And that course in Beijing University was to start in about 3 weeks only, the next course in which I could have gone. So everything was just settling down there, as I call destiny. So I said, all right. After having talked to them, I was quite convinced that it is quite an effective therapy. And since I realized also that there was nobody in India whom I could find out who was doing acupuncture, I thought probably it would be a new science. And the doctors were quite positive about the results which they saw. Not only in pains but also in respiratory disorders, in chronic sinusitis, asthma. So they waded me through a lot of conditions which they have been treating. And so I got a bit convinced. I said, no worries, I would definitely want to utilize my that time of 6 months, because in 3 months' time the results would be out. And if I get my MD, probably I might join in. and forget the acupuncture part. But if I do not get through, then probably I will be continuing with the acupuncture part. And as destiny would have it, once the results came out, after 3 months, I was getting dermatology, which was not my choice, and I wanted medicine, so which was I was not getting. So I think destiny had already decided that I would pursue my career in acupuncture, and I continued there. And 6 months I was there, and then through the professors who were teaching me in Beijing University, they suggested of some Chinese doctor who was in Switzerland, who was Zurich, who was doing very well in private practice. So they suggested you go to him and pursue your clinical experiences with him, and learn more clinical work in a private setup, because Beijing mostly the government setup was there. So from there I went to Switzerland, Geneva, Zurich also I was there, and I learned a lot of practical part. So in all, it took me about nearly a year before I was back to India. And I remember very well the first time that I was treating a patient, when I did the opening of my clinic. It was a very surprising thing, because I had invited a few of my GPs from my own colony in North Delhi, where I started off. I never had space, because my dad said, look, we are middle class people. I can't afford to give you space. Even my budgeting for my visit to China and the fee and to Switzerland was done by my sister. And my father was very strict that once you start earning, you have to give her back, because we don't take it from girls. So all those instructions were very clear cut. I said, Dad, it will be done, and the agreement has been signed. MOU is already signed. So don't worry on that, because I knew this was coming. So it is good. It is good in a way, because I think the responsibility then comes on your shoulders, and you have to be responsible in life. So all said and done, I was back, and then I used to have only one patient a day for the first 3 months. I must share with you that. And I used to charge us 100 rupees for a session. We started on that level. And my dad said, I have got a drawing and dining separate, so मैं तेरे को एक कमरा दे देता हूँ, and we will keep our drawing dining one room, and I'll give you one room to start your practice. So I started like that, and I put just 2 beds with a makeshift, curtain in between. जो पुराने ज़माने में curtain हुआ करते थे नर्सिंग होमों में और क्लिनिक्स में, तो वो लगा के और शुरू कर दिया हमने काम. और 3 महीने में एक मरीज रोज का देखना, आप सोच सकते हैं 100 रुपए रोज कमाना. It was a really tough time. And my doctor colleagues who had come first day and shown me demonstrating it on one patient, acupuncture, said, Raman Kapoor, ये क्या सीख के आ गए आप, ये तो मुश्किल है, acupuncture तो कोई नहीं कराएगा, 6 महीने इंतजार कर लो, आप GP कर रहे होगे. So I was very, very upset day one only, and I talked to my dad. I said, यार ऐसे ऐसे कह रहे थे. तो कहते हैं, what is your experience when you learned there and you? I said, very good results. कहते हैं, then why are you bothered? You do your karam, everything will be all right. And see where I have reached today is just because of the blessings of my parents, as well as the hard work I put in. Because I did not deter from there. That one patient was an asthmatic. 3 months he was on every day he was on steroids, inhalers, and gradually his steroids stopped, and the word of mouth started spreading like wildfire in my colony. So from 1 I grew to 5 to 10 to 20, and that's how this journey started. So I think always, if you toe a line which is different from others, you will definitely have problems in the initial stages. But yes, the important thing is what you learned when you were getting your training done is what should take you forward. So, and today, when I look back, I think it was the best decision of my lifetime. Why? Because I find so many patients who suffer so much just because of Western medicine, that when they come to me, they come at a quite late stage, still, in spite of being into this practice for so many years. But the good part is that when they come, they bring patients with them who are having a short-term problem, like a neck pain for 10 days, like a low back for 2 days. And I get wonderful results in just 1 or 2 sessions. So that is how the popularity of this science is now increasing. And that's why I want more practitioners. One Raman Kapoor can't treat everybody. So that has to be understood. And we need not a team, but we need many more. Many more means there are 50 lakh practitioners as of today in China of acupuncture. 50 lakh. And in India, if you include all the people who are practicing, which includes non-medical people also, it doesn't cross a 1 lakh mark. So we are way behind China, way behind. So even if we start now, I think we will require many more years to reach that level. But I think important is that, as I was talking to you before also, that my aim is that once the recognition comes in a big way of these courses and all, the idea is to make acupuncture available in every government hospital. So let us start with Delhi as a platform. Initially, maybe start in 2 or 3 government hospitals in Delhi, because I am sure the only way we can promote this science is if we give it free to the patients. A paid clinic like me cannot promote it. Only trained doctors working, or trained people who have done their diploma and degree courses, working in a setup, a government setup where it's available free of cost, will definitely help in promoting the science in a very big way. And then there is no going to be no looking back, because that is the way the system grows. Few private practitioners cannot promote it. That's for sure. And with that dream only, I am going forward, so that more and more people are able to take benefit of this time. Now I start with my presentation with the permission of Dr. Ranjan.
Yes, sir, definitely. And now, after basic introduction, we can come to the
So
actual
acupuncture is
content.
basically an ancient Chinese art of healing, and this is about 5,000 years old. What is acupuncture? It is basically a Greek word consisting of two words, acus and puncture. And acus means needle, and puncture we all know is to penetrate. And so there are nearly 800 acupuncture points today and 12 primary channels which have been identified. In addition to these 12 primary channels, there are also front and back midline channels along with these points exist. And these 800 points add up the special points which are now known to practitioners of acupuncture, which include the tongue style of acupuncture points, the tan style, the ear acupuncture points, the scalp acupuncture areas. So it's a huge science, let me tell you. If anybody thinks that he can do a weekend course and be an acupuncturist, he is fooling himself. He is going to fool his patients also. So there are no shortcuts courses. It's a very wrong, it's a misnomer. If people are going to do that way, they will land up with no results or very, very poor results. And that is the reason why a lot of people who claim that they are doing acupuncture are not able to do commensurate with their results, because they have not got a proper training. So I will always emphasize on the fact that the proper training is very important. And to meet that end only, I requested my wife, Dr. Sunita Kapoor, who's also a pediatrician, and she works with me, and she also only does acupuncture, to start training doctors, because one of us had to look after the clinical practice. So she supported me, and she is the one who conducts courses on acupuncture for doctors, and she's been doing it for last over 16 years now. And every year we get about 20 doctors or so. So we have already trained about more than 400 doctors in India, and a few from abroad also. And the course is very simple. It's a 1 year course. And whenever Dr. Ranjan does plan to call Dr. Sunita in, she would be sharing the entire course curriculum also in detail, uh, because this course is entirely, the theoretical component for medical graduates is entirely online. So you can do the theoretical component online. And for the hands-on training, we call the doctors to our clinical setups, and every 3 months, 10 days. So in all, you come to us for 40 days in a year, and about 6 to 7 hours of clinical hands-on every day. So it is almost about 240 to 50 hours of hands-on training, which is what the WHO recommends. So our courses are exactly for medical doctors as per WHO guidelines. We are strictly following that. Now, how it all started. So, once a Chinese soldier developed a stiff and painful shoulder, and in spite of the doctor's best efforts, he got no relief. So, one day a miracle happened. His leg was wounded by an arrow, because of which his painful and stiff shoulder became movable and pain free. So, you can see in the picture, he's thanking, thank you, my enemy. I am grateful to you for shooting me in the leg. You have cured my frozen shoulder. So it's that interesting, and you'll be surprised that point on the leg is stomach 38 acupuncture point. And I still use it almost every day in my practice where I get a frozen shoulder patient. And you'll be amazed. The patients actually start calling you a miracle doctor. Why? Because just putting one needle at an acupuncture point, you can make the patient move his frozen shoulder immediately. It may not be cured in a session, but if the movement starts coming in after one session, obviously that in itself is a big relief to the patient, because they have tried physiotherapy, they have tried lasers, they have tried TNS. When they land up with me, I think they almost tried everything on earth, as I call it. So if that type of a patient can get response, obviously there is much more to the science than what we are all seeing. Now, what are acupuncture meridians? So basically, we talk of the meridians. Now, many of the points on the surface of the human body, they have got the healing effects, and these points are located on the acupuncture meridians, and these are near nerve endings. So when we stimulate them, you have the therapeutic effect. Now, international acceptance of acupuncture, the WHO approved acupuncture for the treatment of following diseases. Now, this is a list which is available online also on the WHO website. So, respiratory disorders, this is a list, official list, which WHO has approved, wherein it strongly recommends the use of acupuncture. And to my amazement, and to amazement of a lot of you, you'll be surprised to know that the latest 2019 to 2023 document of WHO on traditional methods of healing clearly states that next to Western medicine, which is allopathy, the most commonly accepted and most commonly practiced system of medicine is acupuncture. Even I was surprised. I thought there would be something else, could be yoga, could be other things. No, it is most commonly accepted method worldwide. So respiratory disorders is one, then the GI disorders, then the gynae disorders, then neurological, then musculoskeletal, and then the miscellaneous disorders. So if we take the respiratory disorders where WHO recommends acupuncture, it includes acute and chronic pharyngitis, acute bronchitis, rhinitis, sinusitis, tonsillitis, bronchial asthma, and common cold. GI disorders, chronic colitis, gastritis, chronic ulcer pains, constipation, diarrhea, and the most commonly seen problem, which I treat many in my practice, the irritable bowel syndrome. Gynae disorders, dysmenorias, irregular menstruation, morning sickness, and infertility. I would add here, Dr. Sunita has done specialized courses in using acupuncture in gynae disorders, and she's traveled abroad to US and Canada, especially to learn these, because there are people who in these countries who are super specializing into these fields. And one of the her areas of interest for which she's been overworking for over now a decade now is infertility. So we get a lot of patients who are now being referred to us by gynecologists, failed IVF and IUIs, not able to conceive, are able to conceive with acupuncture, and their hormone problems or the hormonal imbalances can be corrected by acupuncture. So this is great, why? Because these patients are looking for alternatives, and we are able to give them a completely healthy child without having to go through the trauma. So a lot of patients wherein there is no reason why conception is not happening, idiopathic cases also we get, and we are able to get very good results there also. Then amongst the neurological disorders, facial paralysis, we get a lot of patients, migraines, hiccups. Hiccups I've treated in the emergency situations in Ganga Ram Hospital, where I get calls from my colleagues now, intractable hiccups following a bypass surgery, even injectable, largactil and all not working. So what to do? So next call comes to RAMAN Kapur, saying, all right, kindly come over and use your treatment. And within 1 or 2 sessions only, we can immediately stop these hiccups. So great. Today in the emergency room, in a lot of hospitals in the US, an acupuncturist is a must, because you can use this technique to give immediate relief in a lot of conditions. Then intercostal neuralgias, we use a lot of acupuncture, peripheral neuropathies, trigeminal neuralgias, hemiplegias. You see, these are areas where Western medicine doesn't offer anything. We have to also understand the limitation. Every science has its limitation. I am not saying that acupuncture is a panacea for all. But if we move together towards a more holistic approach to therapeutics, towards a more holistic approach to how to treat patients, I think all of us are going to be winners. There is no system which is as complete, and that is why each system has got its own positives. So we should try and use the positives every system has given to us, and then go forward. Somebody asked me jokingly, Dr. Kapoor, what is it that you don't treat with acupuncture? I said, broken bones and broken hearts. Coming to the musculoskeletal disorders where acupuncture is very useful, this is one area where mostly the doctors learn acupuncture. Anesthetists come to us in a big way to learn acupuncture because they run pain clinics, and in pain clinics, acupuncture is one of the methods par excellence. So, soft tissue sprains, arthritis, cervical spondylosis, frozen shoulder, tennis elbows, low back pain, knee arthritis, sciatica, uh, sequelae of poliomyelitis, tenosynovitis. So, if you were to ask me, 70% of my practice also revolves around musculoskeletal disorders. But I am lucky that I have the 30% practice also going, wherein I treat other conditions. Like I told you, my wife is into infertility. So, I will share the other conditions also, like hypertension. I will obviously be, if I was to treat about 30, 40 patients a day with acupuncture, I must be having one or two patients who come to me for hypertension, a few patients who come to me for optic nerve atrophy, a few patients who will come to me for enuresis in children, nocturnal enuresis, Meniere's disease, tinnitus. So these are also areas where acupuncture is very useful. Now, we go to the theory of acupuncture. So, acupuncture is basically based on the principle of flow of chi or energy in the human body. So, you can see we are getting our energy from where? From heaven and from earth. These are the two sources. And the human body is made up of five elements, as Dr. Ranjan must be knowing that we talk a lot about five element theory even in Ayurveda. So, these five elements we all know are the wood, fire, earth, metal, and water. Now, each element in acupuncture theory, we should not, and we do not now call acupuncture as a Chinese therapy. We now call it as a healing method. You see, because anything which is global and acceptable now doesn't belong to anybody. It is a science, and it belongs to everybody. As a matter of fact, there is evidence now from Rig Vedas which suggests, and which is written in the Rig Vedas, that Sui Bhedan was used as a form of treatment in India many years ago, even more than 2,500 years, which is being talked about by the Chinese. So obviously, the systems somewhere started in India, but since the development of the system took place in China, so that is why probably the system became more Chinese. But let me tell you that at the end of the day, most of these systems have their origin in India. So now the energy channels. So as you can see, the blood and chi flows along the energy channels, and this is what produces warmth and supplies energy, which keeps the human beings alive. Now, if you see in the picture, uh, yes, I'll just run that video for you. So you can see that energy going from the pit of the stomach, going to the lung, and from the lung it goes to the throat, and from the throat it is going to the chest wall, and from the chest wall, lung 1 is the first point of the lung channel, goes along the arm, goes through the cubital fossa, goes through the upper arm, and then the last point of that lung channel is at lung 11. So there are 11 acupuncture points. And why I said the stomach? Because lung is coupled with the large intestine. So this is the lung large intestine coupled channel, which I showed you as an example. And these two channels are linked with each other. And lung channel is not only used to treat problems of the respiratory tract, the respiratory disorders, but also can be used to treat pain or any inflammation along the path of the lung channel. And it also can be used to treat problems of the large intestine because it's coupled with the large intestine. Same way, points on the large intestine channels can be used to treat lung problems. So it's very interesting. As you go more deeper into it, you will realize the potentiality of the system. Now, this is the organ clock, which is again a very beautiful concept, uh, and it works wonderfully. And I have myself done some studies on this, and there are research documents. The good part, how acupuncture got to the level of recognition which it is there today, has been the reason has been that medical doctors who are on the board, obviously, one Dr. Raman Kapoor can't get a recognition. There were many people who were opposed to it, which is very much understandable. You know, you have to understand that when you are in a system, like ours in our country, there will be a lot of opposition to any new system coming in. So I also faced a lot of flack, but then the science and the type of publications on PubMed, which are available today on acupuncture, crosses everything else. You will be actually surprised. There are hardly many publications on PubMed on homeopathy, Ayurveda, yoga, as compared to acupuncture. Why? Because there are so many researchers from Germany, from England, from Australia, forget China, Australia, from New Zealand, everywhere. And there are MDs and they are licensed acupuncturists also who have done research work, who have proven by double blind studies, by random control trials that it works. So when it works, it works. So that's how science grows. So it now becomes much more easier for me also when I teach my Western colleagues acupuncture, that they understand the science and then they are able to use it in their practice. And when they start seeing the results, obviously nothing better than that. So this organ clock, which I am coming back to now, has we know there are 24 hours in a day, and these 24 hours in a day are divided amongst the 12 channels which I was talking to you about. So each of the internal organs, there are few hollow organs and few solid organs. So hollow organs are known as the Fu, and the solid organs are known as Fu, and hollow organs are known as Zang. So Zang Fu. So every organ has a 2-hour cycle where the energy flow is peak in that channel. Say, for example, the lung channel has a peak energy flow between 3 a.m. to 5 a.m. And when random studies were done in the US on this, they actually found that the number of people who were coming into the emergency room for an acute asthma attack were between 3 to 5 a.m. So it was not a coincidence. It was something which was told so many years back. And we only confirmed it by our findings now. Same way, the number of heart attacks happening are the maximum between 11 a.m. to 1 p.m. because that is the time of the heart channel when the heart energy flow is the maximum. So it's very interesting when you see the organ clock, and then you can also decide the treatment points of acupuncture. If a patient is coming to you and saying that he or she has his maximum symptoms at a particular hour of the day, you will be getting few patients who will say, look, my problem of IBS is maximum between 5 to 7 a.m. or it could be between 1 p.m. to 3 p.m. that I tend to go to the loo very often. So you have to try and find out from your knowledge of organ clock also which particular channel could be affected, because if it is a time regulated problem, and you can treat that particular channel to get relief or give relief to your patients. So very interesting. Then the traditional methods of diagnosis, obviously this science is so old. So at those days we didn't have any computerized systems. So the traditional methods were only two, the tongue and the pulse. And let me tell you, the most difficult thing to learn is the pulse diagnosis, because it took me about 20 years to master the pulse. It doesn't come so easily. You have to go on doing, and then you master the pulse. And that pulse diagnosis is a great method of diagnostics. So this is the pulse. And then the newer systems which we adopt now in our practice are the AcuJing, or a diagnostic computerized method, which allows us to measure the energy flow along the acupuncture meridians. So there are specific points on each meridian, which are known as the yuan source points, which have the maximum energy flow. Uh, each channel has one point. So you make the patient hold a probe in one hand, and with the other hand you put your probe onto those acupuncture points. So there are 12 acupuncture points on each side, so in all 24 points. So if you see the graph which is below shown, it gives you an average of the readings. So anything between the two dotted lines are considered normal, anything above the upper dotted line is considered as excess energy, and anything below the dotted line is considered as deficient energy. So if you see clearly, the spleen channel is showing deficient energy to a great extent. The bladder channel is also showing a lot of deficient energy. The heart channel also is showing a lot of deficient energy. So according to that, we then go to the syndrome differentiation, and according to that, we make out a treatment protocol. So we have a tool now in addition to tongue and pulse, which is a modern tool, and we can also do a lot of research by seeing these graphs. What are the positive effects of acupuncture? Obviously, pain relief is the first. The homeostatic effect is next, and we all know it strengthens the immunity and it helps us in fighting infection. So on the picture you can see the effects of years of strong drugs. The guy is almost bending forward, and effects of safe acupuncture treatment. Why? Because when you're taking medications, we all know it has to go through the liver. So liver gets affected. So acupuncture is a great system because you can really reduce your dependency on drugs, and over a period of time you can actually make them even stop the drugs. Now, the positive effects of acupuncture, it regulates the physiological and psychological function of the brain. It can be used as a local anesthetic also. And you can see the beautiful part is, as I said to you, frozen shoulder, we put a needle in the leg and we could treat it. Same way, if you could, there's a point on the outer side of the lateral malleolus. If you put a needle there, you can actually make the patient move his neck immediately. So for a stiff neck, acupuncture again is great. So the beautiful part is, if you have a migraine and patient will think, or you will think that you might have to put a needle in the head. No, you can put a needle in the foot and still give relief to the patient for a migraine headache. So it's amazing. It's a pathway. It's the channels along which these energies flowing. And if you know the knowledge, if you have a deep knowledge of the science, you can actually treat such patients very effectively, and the patients also will feel much relief even one single session also. So, what are the factors which will decide the response of a patient to acupuncture? As I told you, most importantly, it is the severity and chronicity of the illness. So, don't expect miracles in patients who are very chronic. Don't expect. We are very clear about that. So, day one only, I'm very open on this. Patients coming to me for a motor neuron disease or an ALS, I'm not going to show them the sky and say, oh, no worries, you will be cured. No, that's the wrong way, because we should know the limitations of a science. If a patient comes to us in an early stage of disease, we can definitely try and stabilize the disease. But there are certain areas where we should be very clear cut that we cannot cure the problem. We could probably give some palliative relief. So we should be very clear. The general health of the patient, if the general health is very poor, then we know we need to first give some tonifying treatments to such patients to build up their chi. Then the constitutional type, find out the constitution of the patient, the family history of the patient. Then emotional balancing, very important. As Dr. Ranjan was asking me today, that why do, you should also talk about PNSD. Now, emotional balance is something which we have been able to do great work by prickling neurostimulation technique. PNSD is again a very new technique developed by a Japanese neurosurgeon who left his neurosurgery practice a good 15 years ago, went deep into acupuncture science, and then decided that he needed to do something different. And so he worked on the dermatome theory. We all know as allopaths what dermatomes are. We were all taught this in our medical school, but we never thought that dermatomes could be utilized for treating diseases. So this gentleman has done a lot of research and documentation, and then he treats dermatomes with a prickling instrument, which is like a needle but not a needle. And you don't have to insert that, you just have to prickle at these specific points, which are almost on line with the acupuncture points. So this is yet another different class wherein I can teach that also. So it's a different style of treatment. There are so many styles in acupuncture today. It's a huge system, as I said to you. And once you know your basics clear, then only you can delve more deeper into it. Then diet and lifestyle, then any medication the patient has been receiving in the past or receiving at the time of consultation. These are all factors which can impact the response of the patient. So if a patient supposes is already on a large number of drugs, it is not possible for any doctor to say, okay, stop the drugs tomorrow. No, that's the wrong way. That's where the knowledge of Western medicine and your knowledge of healing people comes in. So you just don't withdraw medicines all over overnight. You have to be very gradual with that, because their body has got used to that medication. So you just can't ask those patients to suddenly stop all medication. Does acupuncture have any side effects? Absolutely no side effects. It's a very safe treatment. Now we come to what are the methods which are available for patients who are needle apprehensive. A lot of patients will come to our practice who would be needle apprehensive, particularly small children. So we have many techniques now available in my own practice also, and globally also, as the science is now getting better and better. We have TNS, transcutaneous electroacupuncture. We have laser acupuncture, where we use lasers. These are pulse lasers. They are specially used on acupuncture points, and they are the ones which we use for treating patients who are needle apprehensive. Then gua sha therapy, or scraping also as it is known. Then sonopuncture is use of ultrasound at acupuncture points. Then acutron is the use of micro and milliamp pads at acupuncture points, mostly for pains. Color therapy is something which we use in children. Depending upon the problem of the child has got, we can use different color probes at different acupuncture points. Again, knowledge of acupuncture points most important. Then moxibustion is where we burn a Chinese, it's a herb, Artemisia vulgaris, which is packed into in the form of a roll, and you can burn this over the acupuncture points. And then cupping, as has been now popularized by a few of our Olympic champions, wherein people saw those cupping marks and they said, "What is that?" But traditionally, cupping has been used in acupuncture for many, many years. We create vacuum at acupuncture points. Ear acupuncture again is a big specialty in itself, and ear acupuncture points also are used for not only for treatment but also for diagnostics. And there's a special ear probes which are used to exactly locate the ear acupuncture points. And here you can use very small needles, micro needles are available, or even you can use embedding needles which can be placed in the ear very safely, very comfortably, without any pain, and the patients can carry them with themselves. And after a week to 10 days, they can come back and you can remove them. And they work during the intermittent phase of also. Then I was mentioning to you the role of acupuncture in infertility and childbirth. It helps to balance the female hormones. It treats conditions like PCOD, endometriosis, and thin endometrial linings, and it also reduces the pain during delivery. Cosmetic acupuncture is a new growing arm of acupuncture where you can use it for facelifts, for acne, for dark circles under the eyes, for hyperpigmentation, and even for obesity. Now, the good part is that because any micro needles also which are used on the face could leave a blue mark sometimes if there is a small blood vessel which gets punctured. So now we have got totally needleless techniques on the face wherein we have a special instrument which is used for doing cosmetic acupuncture without any needles, and it is great results. Now I come to the second half of my presentation. After having introduced acupuncture to you, I would like to now go into the more emotional aspect of the treatment, because all of you are spiritual healers also. So I thought, let me talk to you about how acupuncture can be used in treating emotional turmoil. And here I must mention to you that the COVID situation, which all of us are going through presently worldwide, is has been a great learning chapter for us. And we also find that a lot of patients will be coming to us for emotional issues, either whether they have been affected by COVID or they have had their near and dear ones getting severely affected, and that has affected their emotional health. So emotional health is one area where acupuncture has got very great results. Emotions. So, what is the acupuncture view? The heart, as I said to you, there are basically the fire element is the heart in acupuncture. So, and which is the emotion linked with heart? It is the anxiety or overjoy. Next element was the earth element, which I talked to you, the five element. So that was the spleen, and spleen is the earth element. And what is the emotion linked with the spleen? The trust, worry, and overthinking. So people who worry a lot or who overthink are the ones who get GI problems. So gastrointestinal problems are linked to the spleen and stomach, and that is why this is the channel which has to be treated when you get patients with IBS who are all the time worrying a lot, and they tend to develop gas, bloating, acidity, all linked to the spleen. So each of these five elements, each of these internal organs are linked to an emotion. Next is the metal. So metal is lung, large intestine. I always said to you, it's a combination of a yin and yang. So like heart, intestine is the coupled channel there, and lung and large intestine. So metal is the element which is linked to the emotion. And what is the emotion linked with lung? It is sorrow, grief, integrity. So most of the time you will find people who have lung issues like chronic asthma, like bronchitis. All these patients will be very sad people. Normally, you will not find too much of joy in them. There are a lot of grieving people, a lot of sorrow. So obviously, it's the lung channel per se which gets affected when you have emotions of sorrow. And that is how, if the lung channel is treated properly, you can relieve that particular emotion also, in addition to the disease process. Then the next emotion is the fear, which is linked to the kidney channel, kidney and UB. The coupled channel of the kidney is the urinary bladder channel. So water is the element, and wisdom, fear, and loneliness are the emotions linked with the kidney. And the liver and gallbladder, and this is the channel which is linked to anger. So the people who are hypertensive, who develop high blood pressure, are the ones who tend to get angry very soon. So many times patients come to us saying they've never had alcohol all their life, but still they have a liver disease. So the experience of these many years tells me, and with many more researchers all over the world, that if you are a person who tends to get angry very soon, anger as an emotion is not wrong, because all of us have to have all these five emotions, but in the regulated amount. But if you tend to get angry all the time, it will impact your liver health, and it can lead to liver issues over a period of many years. So obviously, and liver is the organ which is linked. So we have a relationship now, which I discussed with you. Then what are the seven emotions? As I said to you just now, seven emotions I will again underline for you: anger, joy, pensiveness or contemplation, sadness and grief, worrying all the time, fear and shock. Now, there are other emotions also to consider, like frustration, depression. We have manic depression, which is bipolar also, anxiety and stress, which is so common. So, every culture had something to say about emotions since the beginning of time. So, it's a big passion times. More relevant now because every patient coming to us will always say, I'm stressed. Even if he's still stressed. Because he's stressed, why his neighbor is doing better than him. Now, that is not stress. That is creating a stress on your own. So you don't have to be stressful all the time. You also need to understand that there it is that we need to be more practical in life and try and understand that we also have a journey of our own soul, and try and give some time to our soul and not get embroiled into emotions. Now, the acupuncture view is emotions are important and necessary. Emotions can cause disease, or disease can trigger emotions, and emotions and organs are linked, as I was telling you in my previous slides. So, what is the relationship? So, anger and frustration, as I said to you, is linked to the liver and gallbladder, which is the wood element. I am again reviewing the same. Joy and mania is linked to heart, and the element is fire. Pensiveness or worrying all the time is linked to the spleen and stomach, which is the earth element. The worry is linked to the spleen and lungs, which is again linked to the earth and metal element. Sadness and grief again is linked to the lungs and heart, which is the element fire and metal. And the fear is linked to the kidney and urinary bladder, which is linked to again the water. Yes. So then we come to the organ relationships of other emotions like shock, depression, the manic depression, anxiety, and stress. So we have different yin and yang organs which are related to them, and the different five elements also. Then amongst the Zangfu patterns, any of the patterns can trigger the emotions. Some are more common than the others. So common one is the heart Shen pattern or the liver chi stagnation. And the uncommon ones are the damp heart, heat in the urinary bladder, and the small intestine coldness. So these are the different patterns. But how can someone's human nature be corrupted? By emotions. So when the emotions are out of control, human nature lives in obscurity. It is not that the human nature should be blamed. Rather, it is the coming and going by turn of the seven emotions, which which prevents the human nature from being fully developed. So when emotions are not aroused, human nature will be fully developed. Yet human nature and emotions cannot be separated from each other. So the emotions I will analyze now and offer you an acupuncture point combination. So there are different point combinations for anger, anxiety, joy, worry, depression, bipolar, and fear. So come to the anger part. So main organs, as I said to you, was the liver and gallbladder. The secondary organs affected are the heart and the stomach. So this is considered as a yang on yin emotion. It's predominantly a yang emotion because it comes suddenly and outbursts and then goes down. Therefore, it won't be able to sustain itself for a long time. So it will typically arise suddenly and burn up as quickly. So the different patterns in this are the liver fire blazing, damp heat in the liver, gallbladder, liver energy or chi, we call it, stagnating, and the heart fire blazing. So when the liver fire is blazing, the patient generally has acute and verbally aggressive anger outbursts, which are usually unexpected by the recipient. And then damp heat in the liver and gallbladder, where acute angry outbursts can sustain themselves longer than with the other patterns because of the dampness clogging our senses. So these are the different patterns that I was saying to you. The treatment in general is very important, which I have developed these protocols with my experience of many, many years. This is not something you'll get from the books. So the points which are used are very few. For the anger, like for example, the points are DU20, Yin Tang, all those people amongst you who are practicing acupuncture can note them down. Then in the front, you have the REN 17 and REN 14 points. In the hand, we have the heart 5 and heart 7 point. And in the legs, we have the liver 2, liver 3, and kidney 1 points. So total needles which we placed in all total, bilaterally included, is about 14 needles. And these are sufficient for a treatment for anger. Then we come to the anxiety, again a very common issue. So main organs, as we've already talked, are the heart and the kidneys. Secondary organs are the gallbladder and spleen. And this is considered as an inconsistent emotion. And almost always it's a heart emotion. So there are different patterns: heart blood deficiency, heart chi deficiency, heart yin deficiency. So these are different patterns of the anxiety. So blood deficiency patients generally have mild anxiety, and heart and water deficiency, there is a mild anxiety. It is accompanied by timidity, shyness, withdrawal from society, right? Indecisiveness. So these are the different patterns. And then the treatment, very simple. You are using the points GU20 and Yin Tang, which calms the Shen, the REN 14, 15, and 70 point of the heart and movement of the pericardium. And then P6, heart 3, and heart 7, which are calming for the Shen. And heart 7 is a very just 11 needles. That's it. Joy. Now, joy in quantities which is limited is very good, but excess joy can sometimes also be dangerous. So the main organ are the heart and the heart shen. This is again considered as a yang on yang emotion, and it is very addictive emotion, tends to want to display itself at every possible opportunity. And the various patterns are the heart fire blazing, the phlegm fire harassing the heart chi deficiency, and heart blood deficiency. So these are the different patterns. And what is the treatment? We generally use DU16, UB10, DU14, LI11, P6, P7, and heart 7, and stomach 40. Now, most of these points are used for calming the Shen, and Yuan source points of pericardium and heart are used, which are very, very important for treating this emotion. Then worry. So main organs in worry are the spleen and the lungs. Secondary organs are heart, liver, and gallbladder. Again, this is a yin and yang emotion. Various patterns are there, like lung deficiency, spleen chi deficiency, gallbladder deficiency, and heart blood deficiency. So different patterns, which would be not of much interest to a lot of you. And the point pattern treatment which we use are again DU20, Yin Tang, REN 14 and REN 17, which are the movement points of the heart and pericardium, lung 7, heart 4, and heart 7, which are very useful to calm the Shen, and spleen 6 again, a very important point for calming the Shen. So in all, we use about 12 units there. Then depression. Main organs are liver, heart, lung, and gallbladder. And again, there are different types: the liver type, the heart type, the spleen type, the lung type, the kidney type, and the gallbladder type. So liver type is a cyclical depression. Heart type is depression with anxiety and insomnia. Spleen type occurs because they are spending too much time in the past. Lung type is a distinct depression. Patient knows about it, and the likelihood is that people around them will also know about it. Then the kidney type comes as a direct result of the kidneys, which are losing their driving force of willpower. So when the willpower comes down to live, then you develop this type of depression. So there are different patterns. And the point which we use for treatment are the DU20. The back shoe points are very important for depression. UB42, 44, and 47. And these are the lateral back shoe points. These are very, very important points to learn from the angle of spirituality, because these are the corporeal soul doors, the spirit temple, the ethereal soul gates. So it's great. Once you enter deeper into acupuncture, you realize that you can actually give even soul treatments. So you can even treat more deeper issues with acupuncture. And then in the arms and the hands, you have lung 3, heart 3, and heart 7 as points, and liver 3. So these are very good points. Then manic depression or the bipolar. These are again not mutually exclusive, but still we need to balance both the mania and depression. And main organs are the heart, and secondary organ could be any other organ, particularly the stomach and gallbladder. And these are different patterns of manic depression. And the treatment points would be DU20 again, very important for mania to remember. The back shoe points are more effective for mania. If you see in depression also, I talked about the back shoe points. These are UB15, 18, and 20. And in the hand, we use heart 7 and heart 3. And in the legs, we use stomach 40. So these are great points. And depression in general, the points we use are DU16, DU26, UB10, DU14, LI11, H7, H8, and stomach 40. And in addition to that, I must tell you that if a patient comes to you in any acute stage or with any emotion, you can also do ear bleeding. So there is a point at the apex of the ear. So if you just prick it with a lancet and take out a few drops of blood, you can immediately see this patient getting better with any acute emotional problem. Like for example, patient is weeping constantly in grief. So if you do bleeding at the tip of the ear apex, you can see miraculous results. Same way, using a retention needle at the ear Shenmen point is a great way of treating such patients. Then the fear. The fear, we all know the main organs are kidney and bladder. These are the different patterns of fear, and the treatment points again. In the fear also, the back shoe points have a great role to play. The back shoe of the heart, gallbladder, kidney. Very important. UB15, 19, 23, and 52. DU20 is again another great point. H7 and gallbladder 40 and kidney, which are the Yuan source points of the gallbladder and kidney. Now I come to the latest in the troubles which we are all going through, and these are the post-COVID complications. So I've been doing great work myself, and this is also not a coincidence. It's just because a lot of patients of mine who were getting treatment done from me also went through COVID. And so once they were recovering from the COVID, they started complaining to me about the post-COVID complications. And what are the commonest complications we are seeing today post-COVID? Tiredness and fatigue, difficulty in thinking and concentrating, headaches, persistent loss of smell and taste, dizziness, palpitations, chest pain, difficulty in breathing, shortness of breath, persistent cough. Now, another area where I'm getting a lot more patients are patients coming to me with joint and muscle pains. So post-COVID, a lot of patients have found their old pains coming back. So triggering of the old pains. Anxiety, depression, you all know is very well, is happening too often. And PTSD, if for patients who have stayed in ICU for a long time, seeing dead bodies around them can cause a lot of trauma to the mind. Post-COVID lung disease, ILD, again fibrosis of the lung, and digestive problems like IBS and bloating. So these are the list of symptoms which we have been seeing as we have progressed in our practice. So during the lockdown, also in June, when most of the practices were, May also, when most of the practices were closed, we were still treating patients 3 times a week. And most of the patients who were coming to me were my old patients who would come to me for their post-COVID problems. And we were very lucky to be able to help them get over these symptoms. So modalities of treatment we use, Dr. Ranjan was talking about, the top of the line is PNST. Then we also use the divergent channel theories. There's so much in acupuncture to learn. I can give you a webinar in each of these separately. Iron cord treatments, guasha treatment, cupping, moxibustion, bloodletting, I talked to you just now. Tung acupuncture points. This is a style of, again, acupuncture, where Tung doesn't use any local points. He only uses distal points to treat local problems. Like, for example, for a shoulder pain, he will use pain in the hip joint. That's a beautiful thing. You'll be amazed. You put needles in the hip and your shoulder gets better. Who can think of that? But when we use it and the patients get better, they get amazed. We also feel that there is much more to the science than what we are doing. Then emotional turmoil, again, ear press needles, as I said to you. For immune enhancement, there are very good acupuncture points. Then there are neuroacupuncture protocols, wherein we would use points on the scalp with electroacupuncture for treating patients who are complaining of disorientation or loss of memory. And then we also always have the classical acupuncture treatment protocols. These are all the treatment modalities which I am using in my practice today when patients come to me. Now, before I end my presentation to you, I would like to share with you this beautiful video, which was recorded by the CNBC TV 18 people at my clinic. And after that, I'll be open for questions. So just watch this video and look for yourself as the patients talk about their own experiences with acupuncture.
Acupuncture, an ancient method of healing, is helping some people recover from post-COVID-19 complications like cough, sore throat, fatigue, anxiety, depression, insomnia, and digestive problems. Padma Shri acupuncturist Dr. Raman Kapur says it can be used as a complementary system. Take a look. Acupuncture, an ancient method of healing, is said to be 5,000 years old. Part of Chinese traditional medicine, acupuncture is known to be effective in treating physical, psychological, and emotional conditions. The traditional medical practice has been acknowledged by the WHO in its 2019 Global Report on Traditional and Complementary Medicine. It's also recognized as an independent medical system in India. Acupuncture is a drugless therapy that's effective in pain relief, neurological disorders, strength, and immunity. Today, this complementary form of medicine is also being used to help people cope with post-COVID complications. According to India's renowned medical acupuncturist, Padma Shri awardee Dr. Raman Kapur, acupuncture is helping patients get relief from complications like persistent cough and sore throat, fatigue, anxiety, depression, insomnia, and digestive problems.
We should have treated almost about 40 to 50 patients in all, suffering from different type of post-COVID complications. The success rate in patients who had issues like anxiety, stress, patients with digestive issues, patients with loss of taste and smell, fatigue, all these issues, the results were almost 80%. Commonest problem which I found is extreme fatigue, which a lot of patients have been complaining even after 3 to 4 weeks of having come out of hospital stay or home stay. This extreme fatigue is basically being caused because of a reduction in the entire energy.
I was infected with COVID in April this year, and it was a moderate infection. So it took me 10 days to recover, and I had a lot of fatigue during the infection, and post-infection it increased. It took me 5 to 6 attempts to feel better.
Another common problem which is post-COVID, a lot of patients are facing is stress, anxiety, insomnia, fear. Now, these are all stress-related issues. A lot of patients will come to us saying that post-COVID, they are still not getting normal sleep. Even if they have not had COVID, A lot of people will come to us saying they are fearful of developing COVID.
मुझे लास्ट ईयर कोरोना हुआ था लास्ट ईयर, और उसके बाद मुझे काफ़ी टाइम रूम में रहना पड़ा। उससे मैं काफ़ी डिस्टर्ब हुई रही। जब मेरी रिपोर्ट नेगेटिव आ गई थी, मैं यहाँ पे आई, इन्होंने मुझे देखा, उसमें बहुत ज़्यादा मेजर डिप्रेशन में थी, एक्सेस में।
We treated her with PNST, which is a prickling neurostimulation technique, and we treat the balancing of autonomic nervous system. In this, the sympathetic overactivity, which is causing the depression, the insomnia, is reduced.
Another problem which post-COVID patients are coming up with is post-COVID pains. And these are getting triggered off, particularly in patients who have had old history of, say, a neck pain or a cervical pain or a mid or low back pain. And suddenly that's flared up again.
So there were two major issues. One was a prolapsed intervertebral disc, which is basically a desiccation in one of the discs in my lower back, which was causing extreme numbness in my left foot. So Dr. Kapoor and Mrs. Kapoor, they treated that problem completely. And the other issue was related to some digestive issues, and that was also totally cured. That also came back.
For his treatment, I specifically chose two procedures. One is called as cupping. It's basically they cause suction, and because of suction, there is increased amount of blood flow in the area of his aches and pains. So this helps to release the muscles, to make them less stiff, and to release the inflammation. Second technique which I use for him is known as soft laser.
Saying that Western medicine is the only system forward. We are not saying acupuncture is the only system forward. We say a holistic approach towards health is what is important. And for that, I think acupuncture will be a great complementary system. It should be used as a complementary system. And in conditions where we find that Western medicine is causing a lot of side effects to our patients, acupuncture can be used also as an independent system. That's why the government has finally acceded to our demand and accepted it as an independent system of health.
Acupuncture, an ancient method of healing.
Thank you very much for your patient hearing. And I hope I have been able to do some justice in the time given to me, and making you understand acupuncture, making you understand the relevance today of acupuncture in practice, and also making you understand that how acupuncture can be, COVID can be, post-COVID complications can be managed. We had one Dr. Vijay, I think, who had talked about his experience with treating his own mother. I have also treated patients with COVID at home. The only problem area is when you get active COVID patients, the problem area is that you can treat them with acupuncture, but obviously you need to take all the COVID precautions, which would mean you would be entering into a room which is COVID positive patient with a PPE suit. So that is probably one of the factors which probably prevented us in doing active acupuncture in COVID cases per se. But post-COVID complications, we have done a lot of patients, and I am confident that acupuncture is here to stay. And I'm sure many of you who have, sat down today to utilize or to sit down and listen to this talk today will be going back with much more knowledge about acupuncture, and think in terms of learning acupuncture as a modality of therapeutics for your practice. Thank you again, Dr. Ranjan, and thank you, Dr. Sachin, and all the organizers of Spirituality Talks for having invited me today. Any questions are most welcome.
Sir, one thing is how to learn these things from your institution or otherwise.
See, very simple. As I said to you, that at the moment, the people who are allowed to practice acupuncture legally speaking in India are the people who are qualified allopaths, homeopaths, Ayurved, dentists, and physiotherapists, because that is the official order which was passed in 2003, then rectified in 2017, and then further rectified in 2019. So there are three orders of the Government of India, Ministry of Health, which allowed them. And again, as I said to you, I have been working very hard because we have been getting requests from different quarters for allowing them to use acupuncture in their practice. So legally speaking, these are the people who can practice. That means anybody who has done a full 5-year degree course in any of these systems, they are allowed to practice acupuncture. And I think the reason is very clear. And I think you'll agree with me that when you are using a needle, obviously, unless you have a proper knowledge, think yourself as a patient. And if you were to go to a practitioner, you would obviously should be feeling confident that the doctor doesn't harm you. You see, because that is important. Doing acupressure is a much simpler job because you're only putting pressure at points. But when you put a needle into a human body, obviously your knowledge of the anatomy, physiology, pathology should be really good so that you do not give any harm to the patient. So that is one of the reasons why I feel that it's important that the practitioner should have a basic knowledge of the anatomy, physiology. So all these people are allowed after doing a 1-year degree, course, which is basically a certificate course, which we have been doing for the last 15 years now. We even tied up with the Indira Gandhi University for about 6-7 years. We were doing it with them. Now we are planning to shift over to the Amity University. The Amity is wanting to tie up with us for this 1-year program. And as I said to you, it's not that you need to be there all the time for this 1-year program. It's an online thing where the entire theoretical component is given to the doctors online, and there are modules and there are systems of you grading marks for that. And only after every 3 months, the doctors come to us for 10 days for hands-on training. So 4 times in a year, and which is about 250 hours, which is as per WHO guidelines laid down for training of medical doctors. The second line, which I said to you initially also, that to popularize the science this is not the way. To popularize the science, you need to have more young people and more people who are from diverse backgrounds, but keen to learn acupuncture. So with that in mind only, we decided to approach the government, the central government, and after, I must tell you, after many years of struggle, 2019, a landmark decision was taken by the ministry under the leadership of Mr. J.P. Nadda, the then Health Minister of India, and an order was passed wherein acupuncture was accepted as an independent system of healthcare in India. And a committee was formed, an expert committee was formed under the chairmanship of Dr. V.M. Katoch, who was the ex-DG of ICMR, and I am the vice chairman of that committee. And we had almost about 15 members of the committee, which included doctors from PGI, from AIMS, from Lucknow, from very high institutional people, and they were all members of that team, Apex committee, and that Apex committee had meetings almost every second month, and over a period of about 15 or 20 meetings which we have had over that period of 1.5 years, final decision was made on the type of courses to be given, on the course curriculums to be made, how a council would be formed, how we will go forward with the council formation. And in that, we have decided to go ahead with 2 types of programs. And these are all as per international norms, I must tell you. We have taken the experience of different medical acupuncture schools the world over, from New Zealand to Australia to the US. There are schools now of acupuncture all over globally. And the course curriculum was made as per international standards. And we have given that to the Government of India. It's a 3-year diploma course after class 12 and a 5-year degree course after class 12. So you have a degree course and a diploma course, and these courses can be run concurrently also. Suppose a person wants to, after a 3-year diploma course, shift to a degree course, he can do that also. So it's a very, very deeply involved system. And the final report, which has been communicated to the ministry already and submitted in June of 2020, clearly states that acupuncture has to be accepted now and as a system, and the courses should be started ASAP. and the only thing was under which ministry it should come. So as per our recommendation and the recommendation of the chairman, Dr. V.M. Katoj, it should come under Ayush, which is the ministry to look after all the traditional systems of healing. And so acupuncture should come under that. So this is under the active consideration of the Ministry of Health as of today. And I hope as the COVID wave is now coming down and hopefully doesn't come back, we are confident that the government will accordingly set up the councils and we go ahead with the process. Because I also feel that unless we provide this facility free of cost at government-run hospitals, we will not be able to promote a system. If we need to promote a system, we need to be making it available to the common man. And for that, the best way forward is, like today, we find homeopathy clinics, Ayurveda clinics available in government hospitals. You can just walk in and get Ayurveda medicine or homeopathy, everything. So we are also looking forward to acupuncture being available and at free of cost to people. We are there to train. So the training part should be left to the experts. And once the training is done and more qualified people are available, then the things will be very, very fast and more people can utilize this system in their practices. And the private setup always will be there required there. So those people who want to learn for doing it in their private practice, they are also welcome. Those doctors who or other conditions, like for example, as I said to you, in the US, every team of infertility today, every team of doctors has to have a medical acupuncturist, has to have by compulsion. The reason is very simple, because this helps in not only treating the patient per se for his hormonal problems, it also helps in keeping the emotional health of the patient right through the entire conception to delivery. So we treat them from conception to delivery, and even till the last month of delivery, these patients come to us maybe even once a month.
Thank you, Sir Raman sir. Thank you for your time.
Thank you very much, sir. Thank you,
inviting us.
Ranjanji, for giving me the platform. And
any final message,
thank
sir?
again everybody for
last message.
Final message is, I think more and more people should come forward to learn acupuncture. That is the only way forward, and try and promote the science amongst your near and dear ones, and try and talk more about the science to others in your circle of friends, relatives, so that the awareness is there. Because I still feel in India we are at the very primary stage. It's going to be a long drawn out battle, and it will take a lot of time before the awareness grows to a level where everybody knows about acupuncture. So the more people can talk about it, the more you create awareness about it, the more are the chances that more people will get benefited. Thank you very much, sir, again. Thank you.
And in the last, I also would like to thank Vinita Tiwari ji, who was instrumental to invite Raman sir. Vinita ji, आपका कुछ कहना?
थैंक यू रमन सर, आप यहाँ इस चैनल पे आए और आपने अपनी इतनी अच्छी नॉलेज यहाँ पे सबको दी, उसके लिए आपका बहुत बहुत धन्यवाद.
Most welcome. Thank you very much.
Thank you.
Thank you.